So, quick intro for those of you that are new. I'm Melissa Moore. I work at the Taylor County Health Department. Proud to be able to have this session here today in partnership with our UW Extension Office, as well as Aspirus. This is going to be part of an ongoing series that we're planning on kind of getting to know your community. So if you have any ideas about future groups or future populations that you'd like to see us bring in and learn more about, please do share that with myself. Share that with Michelle Grimm out over in the back there, or Amanda Lane from Aspirus, and we'd be happy to try to make that happen for you. So with no further ado, I'm going to turn it on over to Mark Louden. Dang it!
By the fourth presentation, Melissa, you'll get it right.
Thought I looked at like Lou. No.
No,
See, I thought it. I said it wrong. So thank you, everyone. I'll welcome Mark.
Great, thanks for everybody for coming. It's really nice to see Kelsey and Katie here too. My friends from Clark County that I've only seen online in the past. It's nice to have you guys here too. So some folks I know online are carried over from the first session, the general session, and I know that there's some folks in person here that carried over. I'm going to be doing a little bit of overlap just for the folks for whom this is the first presentation today, but I'm going to be talking about plain health culture. And I like the term health culture because it's a kind of overview term that talks about how any group of people, not just plain people, but a group of people understand health and well-being, health maintenance, health restoration, accessing health care, these kinds of things. It's sort of a nice term that I think medical anthropologists actually originally developed, sort of idea of health culture. So really understanding that, things about health are not just about, say, biochemical processes or the business side of like what insurance companies say, providers can give and not, and that sort of thing. Also from groups of that, and of course, individuals make choices and have understandings about health and well-being and how they access healthcare or not. But groups of people can also have sort of distinctive approaches that we say, I think health culture kind of makes sense here. So that's the term that I'm using. I'm going to be talking about there we go. A range of different groups. So plain is a general term that's used to describe members of a branch of the Christian family of churches who identify as Anabaptists, right? Anabaptists, whose roots go back almost 500 years to the Reformation. The Anabaptists were part of a group of reformers that split away from some of the larger established churches and had a number of distinctive practices. The major way that they differed from, say, Catholic, Orthodox, and Protestant churches was the practice of adult baptism, or so-called believers' baptism. Now, to this day, members of churches like mine, which is a modern Mennonite church, Amish churches, and then other groups that are called Brethren and Hutterites, all of our churches practice adult baptism, which is sort of like baptism, first communion, or confirmation, first communion, all kind of rolled into one, whereas other churches kind of spread it out. It was considered radical 500 years ago. Today, it's not particularly controversial. There are a lot of churches that say, you can, wait until you're somewhat older to be baptized. But there are 4 different Anabaptist groups, 3 of which are represented in Wisconsin. So Wisconsin is not a gigantic state, but it has an incredibly large and diverse plain population. So traditional or conservative Anabaptists, and plain basically goes back to people that dress and groom themselves distinctively and limit technology. That's really where the term plain comes from. Originally comes from Quaker terminology, and then was applied to Anabaptists. The largest plain group in the United States and Canada today are the Amish, and that's true for Wisconsin as well. By far, the largest plain group in Wisconsin are Old Order Amish, horse and buggy driving Amish. That would be this box here, right? Now, there's a lot of other boxes under the Amish label here. And even this box itself, you can subdivide 40 to 50 different times. There's an incredible amount of diversity that this chart here only scratches the surface of. Lots and lots of different Anabaptist groups. Mennonites are also very, very diverse. The major the Mennonites who are in this part of in Wisconsin are these 2 groups that are under the so-called Old Order Mennonite branch here, the so-called Grofdale Conference, which are identified here because of that color, horse and buggy, like the Old Order Amish, and then the so-called Weaverland Conference, who are very, very similar in terms of the dress. Women's coverings look very similar, but they have owned and operated motor vehicles. So, and it's typically, originally they were called the black bumper Mennonites, because when they bought cars and when you could still get chrome on cars, like on bumpers, they painted them black, and now it's rubber bumpers and it's black and all that sort of thing. Not all of them drive black vehicles, some things, but they're usually muted colors. So it's not your reds or your oranges or your yellows or something like that. And a lot of minivans and that sort of thing too, because of the large families. So those are the two forms of older Mennonite, those that drive cars and those who operate horse and buggy today. Brethren churches are also known as German Baptists, or just simply Baptists, but not English Baptists, because they practice full immersion baptism. They're not a large presence, plain presence in Wisconsin. They sort of look Amish, but they drive cars like the Black Bumper Mennonites. None of them are horse and buggy driving in the state at all. The largest group, and it's still fairly small relative to Amish and Mennonites, are the so-called Old German Baptist Brethren. And the one congregation I'm familiar with is down near Hillsboro, which is a little bit farther south of here, in the town of Hillsboro. This fourth branch of the Anabaptist family church is the Hutterites. These are a communal society. They do not live in Wisconsin. They're mainly in Canada, in Manitoba, Saskatchewan, and Alberta, or Alberta, Saskatchewan in that order, the Dakotas and Montana, and a little bit of the state of Washington. They're a communal society. They actually live in distinct colonies, whereas the rest of plain people live in close proximity and kind of help each other out. And they live, within buggy distance if they operate horse and buggies, but they're not living on sort of like tracts of land where it's only their people living there. Most Anabaptists are not plain. So like the church that I'm affiliated with, I'm a member of, we're not a plain church. We don't dress or groom ourselves distinctively. We don't have any limitations on technology. Very, very few differences between us in terms of lifestyle and the general population. So for example, one thing is that we don't do is we don't say the Pledge of Allegiance. Because that would be considered a little bit too close to worshiping the nation. That we're, praying for the nation, we're grateful for the nation, we obey the laws, but we don't swear an oath to it. We also don't swear oaths of any kind. So like, for example, I serve as an interpreter, a medical interpreter and a court interpreter. And when I go to court, I can't say I swear to tell the truth. I say I will affirm that I will continue to tell the truth, as I always try to do. So there's a few differences that way. So basically, most Mennonites are non-plain. Most Mennonites, is everybody able to see it?
Yep, I'm just gonna get rid of that
Oh, yeah. I could have done that myself.
because it's just there.
So, in fact, people are kind of surprised. They think of Mennonites as like, looking like Amish and living in the United States and Canada. The country that has the largest segment of its population that's Mennonite is Ethiopia in Africa. And basically Africa and Latin America has the largest number of Mennonites, not because their ancestors came from Germanic speaking Europe, but because they converted. And in countries that have had a lot of war torn strife and that kind of thing, the peace message that our churches convey is something that's considered fairly welcome. But the next sort of large gathering of Anabaptists worldwide, which is called Mennonite World Conference, is going to be taking place in Ethiopia, of all places. This year it was in Indonesia, right? So it's really a worldwide group. But in North America, most are of sort of Germanic ancestry. Plain Anabaptists, by far the most plain Anabaptists are Amish. The Old German Baptist Brethren would be in this group here. Other sort of conservative Mennonite groups, there's a group that live in this area that some people may have known. They're called the Holdeman Mennonites. I don't know if that rings a bell at all. Holdeman Mennonites, their formal name is the Church of God in Christ, Mennonite. And they're a little bit like the Black Bumper Mennonites, except they don't meet in large meeting houses. They have smaller churches. But near the town of Cumberland, which I think is like sort of, if I'm looking north, I think this is north probably, sort of northwest. That's where there are some Holdeman Mennonites there too. They would be sort of in this outer ring of plain Anabaptist groups. So plain, just to sort of summarize here, plain people are members of conservative or traditional Anabaptist groups who mark their identity outwardly through dressing distinctively, grooming themselves distinctively, and limiting technology. Older Amish largest, older Mennonite second, same in Wisconsin. The Amish population is among plain people by far the largest. Every time I do this presentation, it's sort of like the national debt thing. It always is going kind of thing. I have to say, okay, what has it gone up to now? Because the plain population is doubling every 20 years. There's no group of people anywhere in the world that's going faster than the Amish and similar groups in North America. Extremely high average family size, between triple and quadruple US and Canadian averages, and a very, very high retention rate of 85 to 90%. Wisconsin, so there's 32 across the United States. There are Amish and then Also plain groups in 32 of them, 4 Canadian provinces, 24,000 in Wisconsin. Wisconsin has the 4th largest plain population. So Pennsylvania and Ohio are always 1 and 2, Indiana's 3rd, and Wisconsin's 4th. And those are old German Baptist brethren I mentioned before. In terms of where they're located in the state, where we are, like here, and it's just basically kind of western Wisconsin, not particularly far north, because traditionally that's not been good for agriculture, although most don't depend on agriculture now. The oldest settlement, Amish, a plain settlement of any kind, is the Medford Amish settlement, which is going on 100 years old, so 1925. The first settlement actually was up in Bayfield and Sawyer counties in the early 19 teens, but it was not successful, mainly because of farming situation was not real hospitable there. And some were into lumber and stuff that they couldn't make it go a bit economically. But the Medford community was successful, and it's the oldest one, so it's coming up on 100 years anniversary. It's not the largest. The largest is the Cashton community down in Vernon County. Second largest one is what's known as the Kingston-Dalton community, which kind of straddles 3 counties, Columbia, Marquette, and Green Lake County, just north of where I live in Sun Prairie in Dane County. It's about 40 minutes up there. And just some few pictures, kids. And in terms of economic profile, plain people live in rural areas, but most do not depend on farming as their main source of income. Part of the draw originally from coming to Wisconsin, not surprisingly, was dairy farming. But as we all know, it's hard to make a go of it as a small scale dairy farmer. If you're doing like these agribusiness conglomerate, blah, 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 milking 24 hours a day, yeah, it's profitable for you, but for your people with a herd of like 20, 25 or 30 cows or something like that, it's not easy. And the market is it makes it very, very challenging. So by and large, and people have studied this, the dairy industry among plain people are better able to ride ups and downs of farm challenges, mainly because they don't carry a very high debt load. So they don't invest in large machinery. Their labor costs are low, their fuel costs are relatively modest. And so as long as it's indebtedness that really does in a lot of farmers, you have a bad year and you've still got to pay the bank, that kind of thing. So if you kind of carry a low debt load, if things kind of go up and down, you're able to weather things. Their overhead is just basically quite low. So, but still it's like maybe at most 20% of plain people in the state depend on farming. Most are involved in businesses like handcrafts of various kinds, anything having to do with furniture making, lumber, home remodeling, roofing, or even Amish plumbers and electricians. They use plumbing, but they typically don't use electricity unless they're older or Mennonite. A lot of businesses, so bakeries, craft stores. Somebody mentioned in the chat, greenhouses and nurseries. That's a very important thing. My hanging baskets always come from an Amish nursery. The mums were looking really good this year too. It's really good. So let's now talk specifically about their understanding of health and well-being. Plain people. This is taken from a really, really good book about specifically the Amish, but it really applies to plain people, plain Anabaptists generally, as far as their understanding of health and well-being, which is really at the core of their health culture. The book is just simply called The Amish, and it's the companion volume to a really good documentary DVD, now on DVD, originally a film for public television, also called The Amish. Most public libraries that have DVDs will have that DVD. It's often streamed online, but it's inexpensive. I highly recommend that. Amish people collaborated with the producers of that because only their voices are recorded, and any sort of video recordings don't show their faces. They just show people kind of looking away or at a distance or something. And they had basically a lot of input into the script. They felt that the script was very much, didn't put them up on a pedestal, did not over romanticize them, but was nonetheless accurate. So this is a quote coming from the chapter that talks about health and well-being from this book. The Amish, or plain people, generally see nature as God's handiwork and think that the more one embraces nature, the closer one walks with God. Likewise, because the body is a natural organism, the more one treats its ills with natural remedies, the more one is in tune with the mysteries of God's intents. The Amish and other plain people see modern attempts to explain and control nature, especially scientific techniques to control the body and prolong life, goals most non-Amish patients embrace as sometimes obstructing the will of God. So the takeaway here is basically natural. Go with the natural route, right? As few medications, surgical interventions, procedures as possible. Now, that being said, there are no religious limitations on accessing healthcare among plain people. There's a small group of highly traditional Amish called the Schwarzentrooper Amish, who also live here in Wisconsin. Some Schwarzentroopers do not allow for open heart surgery. So even like having a pacemaker in there, because in order to do open heart surgery, the surgeons have to stop the heart and put the patient on a heart-lung machine because you can't operate on the heart while it's beating. And then you have to restart the heart. And that for them is seen as too much like playing God, like essentially artificially stopping life from naturally happening and then kind of restarting it. I thought that, because I was involved in a medical case where there was a difference between a doctor and a family whose baby needed open heart surgery and that kind of thing. And so I was involved as a court interpreter and a mediator in that case. And this was a Schwarzentrooper community in upstate New York. And my takeaway was I thought that all Schwarzentroopers felt the same way. Well, even among the Schwarzentroopers, there are 5 different subgroups. And I met a minister from another group. He says, well, our group would allow it. We would allow for pacemakers and open heart surgery. So, but basically, it's not like, for example, other communities like, say, Christian Scientists or Jehovah's Witnesses that don't allow for blood transfusions. There are no formal limitations on healthcare. But when given a choice, natural would be the preferred route. Now, how do you define natural? There's not a really good textbook definition of what's natural. Some people, myself included, would say that vaccinations are a really good example of working with nature to build up resistance. And other people will say, well, no, it's artificial because you're not sort of getting chickenpox naturally and letting your body sort of fight it off naturally. Fits into the COVID situation that we'll talk about later. So when it comes to going from this understanding of kind of a preference for a natural approach to understanding health and well-being, this affects the choices that they make in healthcare. One thing that's kind of a distinctive about plain communities generally, and not just simply about health culture, is that they have other people's backs. Caring for others, certainly medically, but emotionally, spiritually, financially, in some cases, materially, is just what you do. You help people who are in need. You put others before yourself, right? So I like to say that this is sort of a culture of caring for others, and not just simply other plain people. Plain people are often living in close proximity to, or they're always living in close proximity to non-plain neighbors. And sometimes they're living close to, say, an elderly person or a couple or something who don't have kids or family members living close by. And so the plain people will just kind of looking on them in the winter and just make sure that everything's going okay. No gas leaks. They have a wood stove, make sure they've got enough firewood, make sure that the house is staying clean. Maybe we'll just kind of clean for you or something like that. I mean, this carries over into a lot of aspects of sort of understanding their role in their larger communities. Blood drives, plain people are often very, very active in donating blood. Disaster relief, which is not a healthcare issue, but it's something that's obviously an expression of care. There's a disaster, tornado, Hurricane Katrina. There are still Amish and Mennonites going down there and helping with the rebuilding, right? Even though there are no plain people at all in Louisiana. So when individuals experience illness or injury, or when children are born, which is obviously neither an illness nor an injury, it's a perfectly natural thing, the community provides for their physical, emotional, and material needs. Now, that being said, there is actually sort of a network of community internal healthcare providers, especially what we'd say, I call them like barefoot midwives. So not licensed midwives, but who we would call birth attendants, who maybe have an incredible amount of practical knowledge and experience, who, if they were to get the formal certification and training, would have no problems, right? But just lack that kind of thing. On my mom's side, my grandparents were a country doctor and nurse. They lived in northern Minnesota and they built this little itty bitty hospital, which we call a clinic today. It's a hospital in the 1930s. And my grandmother told me, she said, your grandpa is the doctor, she said, but I think I can make better diagnoses because I touch my patients. I'm closer to them. And she said, and I've delivered a lot more babies than your grandpa has. And so and I've come to see, especially the practical experience that nurses have gained, including, I'd say, with diagnoses, right? There's really something to that. So much of what we do in our professional lives is really not what we've learned in classes and books. Especially as we get older, it's like, oh, I had this experience. I had worked with that patient. In my case, I had a student that did this or that. so much of the experience that we draw on is really just from our life practical experience rather than our knowledge. So community internal healthcare is often preferred. It's also consistent with their sort of general desire not to necessarily be off the grid, but to be self-reliant and not dependent on, say, the government, right, for assistance. I often say that plain people are underserved from a medical public health point of view, but underserved by choice, right? I think that's the way. I mean, they basically say, yes, by and large, we're receiving less care, less preventive care, which is another thing I'll be talking about in a moment, but it's not because for lack of, for wanting it and not having it necessarily accessible. There are some, things to sort of make it more subtle, but in any case, that's just sort of where they're coming from. Biomedical preventive and prenatal care are uncommon. It's kind of an attitude, we were just talking about this before. The attitude is sort of like, if it ain't broke, don't fix it. On the other hand, things like mammograms are kind of important because you don't know that something may be on the way to being broke and will eventually need fixing, right? Or, monitoring blood pressure, right? Don't wait until you get like headaches and all these other kinds of things before you realize it's like, maybe I have a problem. Maybe if I'd started like getting my blood pressure checked or, that kind of thing earlier on, I would have been able to head off, heart disease or stroke or something like that. But it's still fairly uncommon. In general, when it comes to providers, they really prefer something like my grandparents, basically kind of like the traditional country doctor, the person that makes house calls, home visits, they call it today. In general, they feel like when they're hospitalized, they feel closer to nurses because they know their names. They're on a first name basis with their nurses. The nurses know them. The docs are kind of in and out more. The docs that I work with, I work quite a bit in a volunteer capacity as a patient navigator at UW Hospital and American Family Children's Hospital. And it's really interesting with some of the providers, the physicians that I've been working with for some years, they say, I've really learned to be more patient, to become a better listener, and to let them ask more questions than I was inclined to do before. And this one doctor is the director of our burn unit, says, Mark, he says, I'm a better physician because of his experience with plain people. Let's say the kind of country doctors, midwives, probably the segment of provider that they feel the greatest proximity to. And of course, midwives, very, very sort of natural approach. There was a family physician, actually, Jim DeLine, Dr. DeLine, who's the founding medical director of the Lafarge Clinic, family practice physician. He said, Mark, he says, I was deathly afraid of delivering babies. He said, I had to do it in my medical training. He said, but I just thought this was an emergency waiting to happen. And he said, but through the midwives, and he said, through the Amish, he said, it's the most natural thing possible. He says, I never thought I would be saying, I don't deliver babies, I catch them, which is what the midwives say, right? It's mom who's delivering the baby, and she's not a patient. She's just a mom, right? And he says, Mark, in most cases, he says, everything's going to go just fine, right? So it's, again, he's become a better physician because of this experience, but also through the important role, mediating role of midwives. Chiropractors, incredibly popular, in part because they're located in small communities. Their costs are quite low. They take more time with the patients. They have that sort of traditional country doctor touch to them. And spinal manipulation, chiropractic manipulation is considered a little bit more natural. Just 2 nights ago, I think it was, I got a phone call from an Amish guy that they don't know, but his brother-in-law, his wife's brother, is the dad of a baby that has SCID, severe combined immunodeficiency disease, in UW Hospital. Baby's just had a bone marrow transplant and she's in the recovery phase. And so I was just chatting with him a little bit. We were talking about what I knew, what he knew, that kind of thing. And I said, so what do you do? And he's asked me what I do. I said, I teach. And I said, what do you do? And he goes, I give treatments. I said, oh, really? I said, is that your job? He goes, yeah, that's my full-time income. And he said, I'm on ABC. I don't even know what it stands for. You can Google it. It's ABC Miracles. It's what it's called. He said, I'm a trained ABC therapist or manipulator. He says, I do treatments. And it's I looked at it, he says, you can find it online. He says, I don't access the internet. I said, but I know that it's online. And he's received formal training. It's a kind of chiropractic of some kind. It's some kind of interesting manipulation. I didn't spend much time looking at it, but you could Google it, ABC Miracles, and it's this thing. And he does that in the community. There are also a lot of what we call complementary and alternative medical practices. So, like if they were to have more access to, say, traditional Chinese herbal medicine or Ayurvedic medicine from India, they would probably say, this is really up our alley. And in some cases, some things sort of trickle down through the sort of natural path, homeopathic, alternative medical network. In Madison, we have MDs and ODs that are doing integrative medicine, which is say like, well, we can do chiropractic and this, or we can do acupuncture and this, we could talk to a dietitian, that sort of thing. A really good example of a complementary medical practice that is just super, super popular, that was developed by an Amish person and now refined by a whole network of plain people, is what's known as B&W. I'm not a trained caregiver, but I'm a strong, I'm not like a telemarketer type or whatever, but I'm an advocate. I do a lot of presentations to nursing classes. I'm going to be at the American Burn Association next summer, the national convention, co-presenting with the director of the burn unit that I mentioned before. First time the American Burn Association is actually having a symposium on B&W. B&W stands for burns and wounds. It's the product name of a honey-based salve that was like an ointment that's used instead of like Silvadine or other kinds of like antibacterial, antimicrobial salves that are used to dress wounds. And then instead of using gauze to dress the wounds, they use scalded burdock leaves, right? And there's something in the burdock leaf that has analgesic properties. So basically it's creating essentially a kind of a local anesthetic, which is completely different from the standard of care in burn and trauma surgery. So basically when you're treating somebody with severe wounds, like a major, road burn or something like that, or any kind, like burn that's over 10% of your body surface area or more, is considered major. The standard of care for managing pain is opioids. That's oxycodone, fentanyl, and morphine. And that would be, they say, well, we really don't want pain medication if we can avoid it as much as possible. They're afraid of addiction. They're afraid of, in general, they say, if you're tamping down the pain, you're not correcting the problem, right? You're not sort of fixing what needs to be fixed. Now, that being said, they will take Tylenol and Advil and these kinds of things too, but they see that as somehow a kind of a necessity under certain circumstances, but something that's not preferred. But when you've got something like this, where basically you're not having your entire body infused with opioids, but just simply the wound site, like as you would, like if getting a root canal or something like that, or having a crown installed or something like that, you just have Novocaine or some sort of local anesthetic. It's basically what B&W does. It's pretty amazing, and the network is really, really growing. There's a national B&W committee that I'm affiliated with. We have a state committee. We have workshops, seminars, also things on burn safety, right? Because plain people, by and large, and kids especially, are more likely to experience burns because of hot surfaces and fires and, like trash fires or something. Wood stoves, coal stoves, like kids like falling too close to a stove, things on, like water spilling off of a stove if a kid grabs a pot handle. By and large, their kind of design of plain homes is what we call open concept. So it's like kitchen, living area, dining room, living room, play area, all that sort of stuff is in one. And then kids could be like getting rambunctious and getting a little bit too close to the stove, right? Or a wood stove or something and getting burned. So that is a risk. And so burn and wound care is something that's an important part of their health culture. So in terms of accessing healthcare, as I say, there are no like theological or doctrinal limitations. So it's like, for example, Jehovah's Witnesses will say no blood transfusions. But one thing that does kind of limit their access to care, make them a little bit more cautious in accessing care, is the fact that they don't carry commercial insurance. And by and large, they will refuse government assistance, right, for like things like Badger Care or Medicaid or Medicare when people get older. They feel very uncomfortable with the whole business side of medicine. And in my several years of work at kind of running interference for plain people and healthcare providers, it's so much easier to work with providers than it is with the billing departments and the revenue cycle departments, the large networks. Talking about like negotiating discounts and pulling the curtain back on what actually insurers do pay, which is not the sticker price, which is what self-pay patients are looking at, the sticker price. It's our system is not ideal. Just came back from Canada 3 weeks ago, and boy, they really have something when it comes to like healthcare and sort of the business side of healthcare, and like capping prescription drug costs and capping the price of certain procedures and pay for doctors and these kinds of things. It's it makes it a little bit more transparent. So they are going to be concerned about cost. There's no question about that, but it's not going to be a make or break deal. They're also very uncomfortable in hospitals like ours in Madison, right? Large teaching hospitals, because they sometimes feel like they're guinea pigs, and that sort of alienation of like, I don't even know really my doc. And the doc comes in, I don't know his or her first name. I have to call them Dr. So-and-so. I just feel like a name and a number here, which they kind of are, maybe a name and a barcode. And so they often feel like they're not getting a lot of information. They often turn to the nurses and the social workers to say, ask more questions, or me, right? I often, people say, I didn't know what to ask. I didn't know how to ask it. Can you talk to so-and-so for me? And, HIPAA is something that we kind of dance around in a lot of ways, but once I know the provider, then I will typically call them or email them and say, okay, can we get a little bit more information that I can then, or that you can pass on in some way, or that I can pass on to them. So they are uncomfortable with the large hospitals. When it comes to mental behavioral health care access, there's a real reluctance there because, and this is true for a lot of people, that they sort of see it as like less a question of health and more just sort of like, well, snap out of it, or just drink a cup of tea or go for a walk or something like that. They tend to be less savvy in terms of understanding how serious in some cases mental and behavioral health challenges are. It's hard for them to separate it from spiritual health, and they're also very uncomfortable with therapy in individual settings because they typically talk not in terms of I, me, my, and more we, us, our, right? They're thinking more collectively. So group therapy is a little bit more common. Community internal resources are something that are becoming more widespread, including actually in Clark County. There's a small, I won't necessarily call it clinic, but sort of like a kind of an inpatient center for mostly women who have experienced some kind of challenge, that are experiencing problems that relate to mental health or behavioral health of some kind. But really, there are not nearly the number of facilities out there, and certainly the number of providers, including, say, therapists. I mean, this is a real crisis in rural Wisconsin, rural America generally, right? There are just so few therapists and counselors to serve the need, including the needs, the culturally specific needs of plain people. And it's, and not all therapists are necessarily very culturally aware or sensitive to, say, plain folks and working with them culturally. This is a chart that I like that has come from a dissertation, doctoral dissertation by a medical anthropologist. I'm just going to summarize this very, very briefly. That sort of talks about the sort of 5 major areas of healthcare that plain people access, from basically the most preferred to the least preferred. So caring for people at home, which is basically the norm. In the old days, there were really no hospitals. Hospitals were more like hospices. In the old days, it was a place where you go where you would like pass away eventually. And if you didn't pass away there, you were likely to get something really like, get sicker or something because of the sanitary conditions in a lot of hospitals. It's not a great place. So most people were treated at home. Many, doctors made home visits at that time as well. So home care is still preferred. I mentioned chiropractic before. Medical tourism is something I haven't mentioned yet. So medical tourism basically describes that plain people, as a sort of as savvy consumers they are, including of healthcare, will travel great distances to access providers that they think are going to be good in terms of the quality of care, the cultural sensitivity of the care, and the cost. So you find lots and lots of plain people joining many other North Americans, US Americans and Canadians, and going to Mexico for care. Mexico, if you ever visit like places like Tijuana or Ciudad Juarez, which are just south of the border, you just see pharmacies, and clinics, and hospitals, and all kinds of things, just like you walk over the border, and all these things that have to do with healthcare. They're serving a lot of US Americans and Canadians who go down there, mainly for cost reasons, right? Because it's much cheaper. And almost all the providers are US trained, right? So there's not really a question of quality either. Plus, there are also things like, for example, Laetrile. And if anybody remembers Laetrile, Laetrile was a drug that was temporarily approved by the FDA in the 1970s as potentially a cancer drug, and was found not to be scientifically effective. And so it's not prescribed by doctors in the United States. You can still buy Laetrile in Mexico. There's some people that think that Laetrile is actually good for cancer patients. Midwifery that I mentioned before, and then biomedicine would be just sort of the general term of like sort of Western medicine or formal healthcare, what you would get when people are trained in nursing and medical schools. To say a little bit more about B&W, because I think it's a wonderful example of their sort of philosophy of natural, community internal, and complementary and alternative medicine. This gentleman here, John Keim, he's in his mid-80s. He's an Amish herbalist who developed this salve, and I won't say necessarily trial and error, but through a lot of kind of practical experience, assisting with, including some of his own kids who had severe burns, but also members of his community, and just a lot of really innate intelligence. And he's just a very, very smart guy who knows a lot about herbs and natural remedies and so forth that he learned from his parents. From Ohio, and then he developed the salve and then the protocol. He wrote a small book that's called Comfort for the Burned and Wounded. And just did one quote from that kind of talks about his sort of philosophy of like, this, nature provides for us because nature is beautiful, nature is created by God. Therefore, until fairly recently, there weren't doctors and nurses and medications. It was basically, people were accessing, maintaining and restoring their health by accessing resources from nature. So he said, I thought of how God created the earth. I honestly felt he kept the poor in mind while earth was being created. If that were true, the people living on islands without hospitals and drugstores should also be able to find necessities for their needs. And since even such primitive people had fire, they would also have burns. So he said, burns are just sort of like a natural part of human existence, especially in traditional societies. Isn't there maybe something out there that we could use to actually heal burns? And this is how he came on this, the B&W burdock therapy, which is not FDA approved. It will probably never be FDA approved because they don't want to submit it to a very practical kind of thing. In order to do like a really rigorous study on the effectiveness of B&W versus kind of standard burn care, you would have to have not separate patients, but one patient who has symmetric burns. So let's somebody who's burned both their arms, say second-degree burns on both their arms. And then you would have to say, we're going to do B&W on this arm, and we're going to do the hospital method on this arm. There's no plain person that's going to say, give me half Monty, I want the whole thing, right? I want B&W the whole way, right? Because they feel that skin grafts and opioids for pain management and the debridement process to clean the wounds and dressing changes, they feel that is simply not as good as the quote unquote natural route that B&W provides. And there is some basis to that. This, director of the burn unit at Madison, Dr. Fauché, who I've known since the very beginning, the first time that he ever had any kind of exposure. This is a Mennonite kid from this part of the state, in Clark County, who had a very, very severe accident. It wasn't a burn, but basically like a leg was caught in an auger bit or something like that. It was a very large tissue damage. And basically the family followed up with B&W for that. And Dr. Fauché said, I've never been trained in this. This looks crazy. I can't believe that it's going to work. But he was patient and somewhat open-minded, and the recovery was actually excellent. And so now he's gone from being a skeptic to sort of a cautious skeptic to being like a very supportive person who gives his cell phone number out to B&W caregivers, trained caregivers, and say, you got a question about something that looks like a yeast infection or something, give me a call. And he said, I'll call a prescription for you. And a lot of times, plain people themselves, typically, they never have tablets, right? They don't have like iPads or smartphones or something to take photographs, but they're also concerned to document these cases for their own records. And so frequently what will happen is that they will have like a neighbor come by and then take pictures like daily or something like that, and then email them to me or to me, to Dr. Fauché or something like that. There's some plain people that do have email accounts, right? More progressive groups, and then we kind of save it there. A couple of times people have asked me to, once their kid has been healed or something, to say, hey, can we get, they have a fairly high tolerance for kind of gory type things. And I say, can we get, like all the pictures like printed out? You have to be really cautious when I go to Walgreens. You can't just feel like some of these things just look a little bit, like whatever, horror films. So that's burdock. It's basically a leaf, but it's known in Chinese traditional medicine, at least for the root, has kind of health restorative properties. But there's something in there that has analgesic properties that creates this natural local anesthetic. So it's this honey-based salve and therapy that was developed by John Kahn. But it was not just like him being the guru of this and everybody sort of going, doing exactly what he said. It's been, the cure is refined constantly. And they're always like getting together for workshops and comparing case studies. And they're saying, did you have a patient that did this? Yes. And this is what we did. Hey, good idea. Let's try oil therapy. What's oil therapy? All kinds of different things that do kind of carry over into sort of other kinds of non-plain alternative medical circles. You can buy B&W salve online for natural foods stores. To say it's not FDA approved, but there is actually an emerging body of scientific research. There are people that have said there's something to this, right? And now the American Burn Association, which is like the AMA, right, for burns and trauma specialists, this is like a big thing. After years of it sort of coming on the radar of a lot of places where there are burn units and trauma centers, and all of a sudden, the director of the American Burn Association says that we need to talk about this. There's something here. They'll probably, because it'll never be FDA approved, they'll probably never be able to like offer it to their non-plain patients. The plain patients say, but at least you can meet us halfway. Because there are certain aspects of very severe burns, like risk with kids, especially risk of dehydration, risk of infection, malnutrition in some cases, where they really do need the kind of like initial kind of doctor's evaluation before they can discharge them and then follow up at home. So there needs to be that partnership there. As I say, it's highly preferred by plain people as an alternative to conventional wound care and pain management. Pain management is the big thing. Just to give you a sense of like, there is at least some scientific research on this. Effective B&W burdock leaf therapy on burn injured Amish patients, pilot study measuring pain levels, infection rates, and healing times. Now, one thing that some providers have often said was like, okay, but in their experience, especially people that work in emergency departments, they say, when they ask, plain patients, people that are admitted, who to rate their pain on the sort of 0 to 10 scale, they say they never go above 5, and there's nothing sort of miraculous about plain people and their sort of thresholds for pain. They're human beings like everybody else, but they tend to complain less about pain. They seem to have a higher sort of mental threshold for pain. So maybe something more to investigate with that. Another thing is sort of B&W burdock leaf and B&W ointment, a natural and suitable alternative to negative pressure wound therapy, the wound vax, and skin grafting in the treatment of traumatic crush injury, post-surgical debridement. Skin grafting for them is like saying, okay, yeah, we can buy sod, right, and roll it out and plant it and, and water it and hope that it grows in the yard. But somebody is like ripping off this sod and the grass from some other and removing nutrients from the soil and then damaging somebody else's soil. Wouldn't it be nice just to plant grass seed and let it grow sort of naturally? But it takes more time. They say, yeah, it takes more time. Well, we're patient, right? It'll take more time. That's their attitude about skin grafts. They also see skin grafts as being less effective in the long run because they see if skin grows naturally back, especially for kids, as kids grow, it tends to be a little bit more pliable, right? Than the skin grafts that may not necessarily naturally grow as well with the skin elsewhere. This is what the setup looks like. This was a boy from the Wilton Toma community who had gotten his hand caught in a roller chain, his four fingers here, and thumb was okay. The index finger was amputated. The 3 other fingers were basically crushed, and the pinky was basically almost black. There's like no circulation there. And so the plastic surgeon said, we're going to have to remove that finger. And they said, oh, come on, is there any other way that we can, do that? And he said, well, there's no circulation. You're just going to have to remove the finger. And they said, well, the doc said, well, we could try medical leeches. They can maybe put them on there and see if they can pull out the blood clots. So they did that for 3 hours, no effect. And then I contacted one of the B&W specialists out in Loganville, and he said, well, the burdock leaves have these drawing properties. That's why you should never put it on stitches or staples, right? Because they'll just pull it out. He said, that may draw out the blood clots. And so I talked to the nurse who then talked to the surgeon. The surgeon was very skeptical. He says, well, we have no choice. He said, I'll give you until tomorrow morning. And this was 6 o'clock at night, and the B&W teams, 2 guys came in, and redress the wound using the salve and the burdock leaves, which is the setup here, and change the dressing every 3 hours, 6 o'clock in the morning. The surgeon came in and removed the dressing, and the blood just started flowing, and the skin the skin on the pinky started to turn pink again. He says, got tears in his eyes. He said, I've never seen anything like this before. He looks at him, he said, well, you guys hit that kid's finger. At 4 o'clock in the afternoon, he was in his van back to home. And then recovered. So what are some lifestyle cultural factors that sort of affect their overall health and well-being? By and large, like a lot of rural folks, get a lot of good physical activity and live a very overall healthy lifestyle. Just simply getting up and moving, walking. Studies have been done about sort of looking at the steps taken by plain men and women. One study from Canada showed, of course, in Canada, you have to move a little bit faster because it is colder in some ways, but your average plain woman in Canada takes about 17,000 steps a day. Males about 19,000 steps. It's much more than the 10,000 we strive for. And thinking about kids, no screen time, 0 screen time. Right? Remarkable community and family stability, which leads to happiness. So your mental health obviously has positive effects on physical health, right? And certainly like will to get better and just, I mean, providers know this as well, right? You know, like having a good attitude, optimism, feeling happy is going to make it more likely that you will recover and quicker. Now, rural farm life is, you know, so like green acres or whatever is very healthy, but also has a lot of dangers. And so farm safety is obviously sort of a major concern. Talked about burns before. They do actually have like seminars and workshops and things like farm safety. Some serious accidents have happened in this area with young kids operating skid steer loaders and driving over other kids, that sort of thing. So it can be, there are some important challenges. And OSHA would be very concerned about a lot of the way that a lot of farms are run. But by and large, being away from you know, sources of major pollution in urban areas and being close to nature, more in tune with sort of natural rhythms is positive for your health. Obviously, challenges pile up more as we get older. And so looking at how elders and the disabled, as they get older, or even when they're younger, are cared for, they're cared for at home, right? So basically, you're in a hospital for only as long as you absolutely need to be, but then you come back. And many would not even go to nursing facilities or rehab facilities and say, we just want to take people home so that we can care for them at home. Physical and emotional abuse are quite rare, but not non-existent. And that's something that I'll talk more about in the service provider, the social service provider session later, things like abuse. Now, when it comes to genetic disorders, a lot of people say, oh, you know, they're all related to one another. That's true. Plain people are all related at some level. There are almost no people that join plain communities from the outside. So in that 367,000 Amish, today it's estimated there's somewhere between like 200 and 250 that were not born to Amish parents. On older Mennonites, it's probably lower percentage. So it's very, very few people that have joined. And they'll often say, it's much easier for us to go in your direction than for you to come in our direction in terms of things like it's easier to gain things in technology. It's harder to give things up, right? So that's why they don't actually recruit or do active mission work. So that means that they're all related to one another at some level, some degree. And that's the formal name for that. Marrying within your community is endogamy. And from a genetic point of view, is what's called the founder effect, which basically means that there are going to be certain kinds of, the gene pool will be limited, which means that certain negative effects from a closed gene pool, like inherited or genetic disorders, will occur at a greater rate in certain populations than the general population. Now, this is true, like, for example, sickle cell. Sickle cell is more common among people of African ancestry, right? Because it developed from something that was originally a protection against malaria, but then it's kind of mutated into something that's negative, which is sickle cell. So if you're not African American, don't have African American ancestry or African ancestry, you're at a lower risk for that. There are some inherited disorders among the plain people, but at the same time, living in a closed society, it means that you're also protected from things like sickle cell, right? Or Tay-Sachs disease, which is more common among people of Ashkenazi Jewish origin. So of the, let's say, like 550 or 600 very clearly somewhat common identified genetic and hereditary disorders, that your typical North American may be susceptible for, at most maybe 50, is what a plain person may be at risk for. So that your overall, there's a kind of protective mechanism there. Beyond that, there are also, kind of colloquially referred to bad genes, there are also good genes, right? And one thing that sort of proof is in the pudding is that there are very, very good family historical genealogical records of plain people going back to when they came here in the 1700s. And their life expectancy has always been very high, right? So basically, always at that sort of lower 70s, lower 80s, upper 70s, lower 80s level, and then sort of ticking upward. In the 1700s and the rest of America, life expectancy was in the 40s, right? So the rest of American society has kind of crept up to plain people, although in the last couple of years, partly due to COVID, it's gone down. In the last couple of years, it's gone down. Plain people are still at this very, very high level. Very, very fertile too. And this is an interesting study that was done of another closed society, which is the country of Iceland. Iceland is a closed society because it is Iceland. It is a very isolated place that's hard to get to, that few people move to. And they've been there not just a few hundred years, they've been there for 1,000 years. So all Icelanders are related to one another. And there was an interesting study that was done of fertility rates, and they found that those first cousin marriages are not possible. The second cousin marriages happen. They found that fertility was somewhat lower among second cousins marrying, and relatively low at fifth cousins and above, but third and fourth cousins were highly fertile, and the kids were overall quite healthy. And so basically, this is a kind of interesting sort of natural adaptation to recognize that in most societies around the world today, and historically for our ancestors, you could get far enough away from people that were related to you to find partners, right? And so, it was very, in my own ancestry, there were plenty of second cousins, and there was even one pair that were first cousins that got married in my own ancestry. It's not unusual for a lot of us, just simply that's how life was. And yet, not everybody had all horrible genetic disorders like that. So the stereotypes that we have about, say, rural cultures in Appalachia or Ozarks or something like that. So there's a good side to being endogamous. And there's a really, really good article that the lengthy article appeared just almost 5 years ago in Time magazine called "Amish People Stay Healthy in Old Age. Here's Their Secret." Of course, it's a little bit sort of like racy by saying the secret or something. It's not a particular secret, but I want to share a couple of items from this. It's like the most powerful weapon in the Amish long life arsenal, however, may be genes. So it's not just lifestyle, but it's maybe genetic. The Amish population in the US is about 318,000. Again, it's sort of like the national debt. It keeps going up. So it's just 5 years ago. Descended from just 200 families that immigrated in the 1700s. They mostly marry, actually exclusively marry within their own communities, which means that the genes that existed when their ancestors got to America have remained. That could be a dangerous thing if bad genes are hidden in the mix, but a good thing if the genes are sound. While no community is without genetic problems, the Amish seem to have gotten a lucky draw. And the Amish have actually participated in genetic studies because they are in some ways an ideal natural laboratory. It's just like, Mendel's keys or something like that. It's just basically they're all related to one another. There are very, very few social differences. So it's like you've got nature and nurture, and then the nurture side is pretty much constant, right? It's just a very, very, from the point of view of like other populations, quite homogeneous. And so you can sort of cross out a lot of environmental factors and then just really kind of zero in on the genetic bases. And so, like, for example, they found that genetic mutation in the Amish is linked to actually longer life. This was in an Indiana community. And then another one, genetic theory discovered in Amish protects from heart disease. One thing that's part of the study that's actually been ongoing or just sort of wrapping up in this area between UW and the Marshfield Clinic, and I'm in there as a cultural consultant, is looking at, it's called the farm study. It's looking at why is it that Amish, but also other rural kids that live in close proximity to large animals, especially cows and horses, from birth on, from their earliest childhood, and expectant moms out there as well, how is it that they have such low rates of asthma and allergies as they get older? Well, they're ingesting what the Amish would say is good dust, right? Building up their immune system by letting the kids get dirty. And there is a scientific basis for this too. And so it's early exposure to some kind of microbes, and that's what we're figuring it out. And actually, like, we have actually dust collectors in people's homes to see what kind of dust is just sort of naturally there, as opposed to what we know is in the barn. And why Amish kids are less likely to get asthma. This was an interesting thing too. So, well, obviously people know that obesity is kind of a negative correlate for a lot of things with health. Again, sort of a lot of physical activity means that their obesity rates are quite low, as opposed to about a third of the US general population. But this is one thing that even my immunologist friends were not familiar with, because it's a little bit sort of, I really like getting into PubMed and reading things. And I thought, plain people are barefoot a lot of the time, right? And it's like, is there any kind of health benefit or, deleterious effects of being barefoot? Well, guess what? There's something that's called grounding or earthing, which basically means if you spend a lot of time barefoot, not on like concrete or artificial surfaces or something like that, or carpeting or whatever, well, in the dirt, it seems to correlate positively with lower rates of inflammation and better immune health and wound healing. And also the prevention and treatment of chronic inflammatory and autoimmune diseases. So like, for example, people that have Crohn's disease or IBD or something like that, autoimmune disorders, much more infrequent among plain people. That could be also genetic as well. It may be another good gene that's at work there. But take your shoes off and start running around in the dirt when the weather's nice. What about COVID? So big picture. So early on, so that spring of 2020 or late winter 2020, they respected the public health directives like pretty much like everybody else. So they closed the schools, suspended worship services, which was something that hadn't been done since the 1918-1990 flu pandemic. And they either suspended or limited large gatherings. So like postponed weddings, made funerals much smaller, that kind of thing. But by the next fall, they were kind of past that. And there is a widespread belief that COVID hit early and hard in their community. And nobody else talks about herd immunity, they do. And they say, well, it's something that was kind of like the flu or a really bad cold, and it's kind of laid up for that, that winter or something. It was maybe even before February 2020, but, and it went through the family, everybody got it. I bet it was COVID. And, it's, again, sort of the natural approach. There has been, I've mentioned this before, with vaccines, you can go either way. A lot of people, myself included, will say it's a great example of sort of working with nature, right, to build up your protective immune health. Some people will argue the opposite. They'll say that it's an unnatural way to prevent illnesses. There's also, and this is not just something a plain thing, but among many plain people are familiar with this, many vaccines, most notably before COVID, was the coronavirus vaccines, were the MMR vaccine, right? Which is not taking fetuses and harvesting them from abortion clinics or anything like that to create the actual vaccines, but in the vaccine development and to a certain extent production and use of fetal stem cell lines that go back to aborted the fetuses that were aborted in the 1960s. That there is truth to that. This has been well known, and in fact, the Catholic Church took a formal stand on it because there were many Catholics who were saying, is this something that is it immoral then to say have like the MMR vaccine? Catholic Church has come up with a very wise statement policy basically about this. They talk about greater good. They say we would prefer that no vaccines or any medications of any kind, and things like Pepto-Bismol and Tylenol that usually draw on these as well. We would prefer that no medications or vaccines would draw on fetal stem cell lines. But it is what it is. It's a historical fact, and there's a greater good, which is the health benefits from a large segment of the population being vaccinated. And so, in the same way that Catholics and other people of faith pay taxes to the government, and the government is using the state or the federal level is using it for things that may be considered against your morals or against church teachings, there is a greater good because most of the tax dollars are going to things like fixing roads and improving schools and that kind of thing that would be considered positive. So they say it's not black and white, it's gray. And it's basically a lighter shade of gray as opposed to a darker shade of gray. And so it's considered, we talk about this greater good. I think it's a very, very wise argument. Now, the political divisions in our society and in many parts of rural America that have kind of rejected anything coming from the government, regardless of who's in power, who's the president, or who's the director of the CDC. In general, that has carried over to plain people. They're not politically active. I like to say that politics is a spectator sport for them. They don't get directly involved, but they're kind of observers on this. And often turned off by politics, but they hear a lot of things from their neighbors, including things that would be considered misinformation about a lot of things having to do with politics and the war in Ukraine, a lot of things. And part of it is, their neighbors, many, all plain people depend on so-called taxi drivers, they call it yoder toters. So like people that haul Amish or Mennonites that, like have 15 passenger vans and then take them on long distances or take them to Costco or Walmart or hospital or something like that. And some of the drivers have very strong opinions about politics and public health and anti-vax, anti-masking, the pandemic skepticism, a lot of things. And so, and the healthcare industry, big pharma, and that does carry over. And then, so yeah, that's kind of goes with that there. And so with that, pretty much where I wanted to be in terms of time. I'd be happy to answer any questions that you might have. And we can go off on any sort of tangents that any of the topics that we have here. And if we've got some questions online, I'd be happy to answer those too, if Melissa, you want to call them out.
Sure. One of the questions goes back to the early beginning, regarding, you had talked about the economy. So do individuals in the plain population go and use traditional banks to buy farms, for example?
Yes. Yep. There's no sort of like community kitty that funds sort of like, that makes kind of like community internal loans or something like that. Now, like in other families, like parents that have more means and like fewer kids or something like that, or maybe able to help kids starting out, like pay the down payment on a new farm or something like that, but they access banking, they have mortgages and all these things like everybody else does.
And then there was related to delivering babies. Do they deliver babies in the hospital or do midwives make the house calls?
About 90% of plain babies born in Wisconsin, and that's probably generally true for most other states, are born at home. And that's sometimes with a midwife, sometimes with a birth attendant. And a birth attendant will be called informally a midwife. That's typically a woman from the community who has a lot of practical experience. That's preferred. It's very interesting because for other people, you go to a birthing center if it's a low risk birth, right? So typically the first choice would be have your baby in the hospital. And then if it's a low risk birth, you go to a birthing center. For plain people, it's the opposite. So the low risk birth, the typical birth is going to be at home. They go to a birthing center before they go to a hospital if it's high risk. So it's like breech or twins. There's no prohibition on going to a hospital, but they would say we just much prefer, and like so many women would agree with this. In the way that a lot of hospitals have adapted and made things, the actual rooms, delivery rooms, less like operating rooms and more like, muted lighting and, that kind of thing. And maybe having like a hot tub or a bathtub of some kind, whatever, to do a water birth, these kinds of things. But one of the challenges about birthing centers is that this goes back to the sort of billing department and business side of the networks. Many of the business people in these larger health networks don't want to support that because they see that as risky and it's too indulgent. It's not worth the costs. And so there are fewer options for women that want to go to birthing, plain women or others who want to go to birthing centers than maybe there had been, like say 5 or 10 years ago. And there's a concern also about a lack of midwives. There are not as many women that are trained to become midwives. And in some cases like Clark County, it's like the plain people are like, was it 10% of the population, but the births is like 50% or something. And it's like most kids born in Clark County are plain, right? Which is because of the large family size. And sometimes there's been a concern in some communities. I know about Clark, but I know in other places where there aren't necessarily enough midwives to serve the needs that are there.
So how did they get to a facility or an emergency room or a hospital?
Ambulance, hire a driver.
Okay.
If, ambulance is very expensive when you pay out of pocket. And so they say, if at all possible, we prefer to hire a driver. Med flights, flight for life, that kind of thing, when it's absolutely necessary, they will do that too, but knowing that they're going to get a very high bill, but the patient is more important. But if they have a choice, they would prefer to hire a driver. But they all hire drivers, like to go to Costco and Sam's Club and Cabela's. I live in Sun Prairie, I have a big Cabela's, and I can pretty much want to look for plain people in Sun Prairie, go to Costco. Yeah.
I have taken care of some Amish children, adults. And, you know, like for instance, if they have surgery and we really would like them to be comfortable to take pain medication, they're very apprehensive to do that. But yet the benefits of pain medication to help them to be able to deep breathe, to ambulate, to do all the things they need to do to get themselves better. You know, they really don't want to do that. So what can we do to help them understand that other than trying to just say what I said?
Say what you said. That's the best thing that you can say. It's very clear. It's basically just kind of making the case like in the long run, this will help you do things that are more natural, like breathing and so forth. Yeah, just exactly what you said. And maybe having like one pagers, right? Just like a sheet that basically says, you know, we recognize why anybody should be skeptical about taking pain medication and opioids in particular, but here are some benefits for maintaining control. And talking about things like you don't have to go, you can have sort of moderate doses, right? You can sort of say, this is not the full, you know, this is not as high as you could possibly go. It's sort of moderate. And saying that because they do get they do have the perception that some providers overprescribe just generally. And that includes pain medication. And so you can sort of say, well, I'm not prescribing as much as I would for my non-pain patients or something like that.
Kind of specifics, I don't know if you have the answer. So talking about natural, I'm thinking about breastfeeding. I'm sure every plain woman plans to breastfeed, but as we know, we can do everything right and maybe just not have the production or the baby doesn't latch. So like, is formula considered unnatural? Would they go to cow's milk or something like that?
Formula
Right.
is considered appropriate.
They would, okay,
Yeah, you know, I mean, breastfeeding, they say this is liquid gold.
okay.
And I said it's the best thing. They just, I mean, which is true. I mean, it's like if at all possible. And I know in other, I've learned in Wisconsin, in other states, La Leche League works actually with plain women to sort of really help them get over the hump.
Okay.
With breastfeeding. And with like jaundice babies, like you know, my wife, she had our daughter was born with jaundice and it was really hard for her to breastfeed. And we had where she was actually able to go back to the hospital for what they call a hotel stay and spend the night. And the nurse who also worked with the Leche League stayed with her all night. Leche is a great asset.
As far as the mental health, when you were talking about mental health and counseling and stuff, it's really hard to find counselors around here or to get patients in to see them. And when you kind of mentioned that they prefer more like group counseling, that's even harder.
Yeah.
So is there anything like through the church that they do some counseling, or what would your recommendation?
So this is where they do medical tourism, because there are facilities out of state that serve plain people. As I say, there's one called Still Waters that's in Clark County. I've actually never visited there, but I've heard about it. Still Waters. It's limited as to who they accept. It's run by either the Horse and Buggy or the Weaverland Mennonites. I'm not sure if it's Mennonite run. And I know of women who have experienced sexual abuse, or usually in an earlier time, and then sort of like coming back and, you know, affected and then having depression or something. I don't believe Still Waters. I mean, there's some of these facilities that have been recognized by courts and sort of in conjunction with social services as like appropriate providers, as sort of like for follow-up for offenders or something. You know, and Still Waters, I think, only works with victims. They don't work with offenders if it's a sexual abuse. But typically it would be like going out of state. So there's like Indiana, Ohio, Pennsylvania, Missouri. I know of a facility that somebody's gone to. It depends. But even there, it's like waiting lists for people to get in. It's like a demand. But there are group facilities that are in partnership with outside therapists, with professionals, but there's no like TV and internet and these kinds of things. There's like maybe a quilting room for the women and a wood shop for the men. And then they offer them like, you know, the ability to have worship services on Sunday. So it's culturally appropriate, because if you go like a lot of other facilities, it's like Sunday is like every other day, or whatever. For them, it's the Sabbath, and you don't do any manual labor and that kind of thing as well.
So there are 3 questions online. So I'll go ahead and run through those. Is there any data that you know of about comparing on-farm accidents or other accidents that involve injuries, comparing farms that are owned by our plain communities versus those that are not? And if you know of any sort of interventions or opportunities to improve farm safety?
It's an excellent question. There are no scientific like studies that have been done to that. You compare, like, say, in the same county or the same community, plain and non-plain farms in terms of safety and accident rates, none that I'm aware of. And but the best thing to do is to have, like, and this is through cooperative extension, they've worked in this too in the past, is to have like offer farm safety days, or like like say basically this Saturday morning or afternoon or something like that. Typically winter is a good time because it's sort of a slow time to have like a seminar on things like farm safety. Another thing that's worked really well is to do small presentations at schools. So like I have a buddy who's a medical doctor, a physician, who's very, very supportive of Amish caregivers with community care providers. It gives them advice on things and medical questions that they have. But he also does things like sort of farm and home safety and sort of basically kind of health maintenance type things with kids in schools. And it's also good because then the teachers are hearing this, and the teachers are kind of getting a little bit of training in understanding some basic things. Also some like first aid, CPR training. That's all. Many of them actually take advantage of that. There are actually Amish that serve on volunteer ambulance crews, and volunteer firefighters, which is often the same department in many cases.
So how do you get into schools? Do you have to go through the teachers, or would you go to the bishop?
Well, okay, so every school has what they call a school board, which would be 3 parents, 3 male, 3 dads on the board. It depends on sort of the relations that you have with the community. You may just be able to, if you know a lot of people in the community, you just sort of say, hey, would you mention this at your next board meeting? If you're less familiar with the community, you may start with the bishops because they're the sort of spokespersons for the community. They're not decision makers. We talked about in the last session, they're not decision makers, but they are spokespersons. And they're sort of a good sort of point of contact. The less effective would be talking directly to the teachers, because the teachers are technically employed by the school boards. And visiting schools is fun. Those kids are so cute. Those, I mean,
The
just,
most beautiful songs in the morning, and they're so well behaved
Yeah.
compared to like your public schools. There's like no control over those kids.
they're so cute. And it's just so neat to see. I mean, it's a little bit walking back in time, like some methods that they teach, because it's like the teacher is not doing a lot of instruction. It's like, sort of, okay, 6th graders, you help the 3rd graders with reading, or 1st graders, you read to 5th graders now. And it's like, this is how it was done, like in my great-grandparents.
It's always interesting, because like you walk in and then you would always expect like 1st and 2nd graders to be in the same room together, and it's like 1st and 4th, but like you were saying too, and it's that makes sense now that you say it like that. And I always kind of I noticed it, and I guess I didn't really give it much thought, but it's always fun, going out to schools.
School presentations are really good, and things all, one thing that's a kind of a frontier about healthcare is oral health. They're not real good about brushing their teeth and getting their teeth cleaned. It's a very kind of traditional attitude that sort of like teeth are not really part of your health. It's just sort of like how you look, and it's okay just to let them kind of rot and then fall out and then have the rest pulled and then get false teeth. And that, again, that's like, this is my grandparents' generation, our grandparents' generation. It's changed, and there was also an understanding there's a connection between oral health and our oral health. But there's less of a recognition that. That being said, though, in the Kingston Dalton community, for the first time, I saw a girl that had braces. I've never seen orthodontia in the plain community before. And turns out that her family not only takes their kids to the dentist for teeth cleanings and stuff, but they actually get them orthodontic care. There have been other examples of, like, for example, of like bringing preventive care to the community, like say bringing a mammogram, semi or something to do screenings, echocardiograms, or dentists or dental hygienists that are volunteering their time to do teeth cleanings. Like you can do these in sort of mobile units as well. Or like here you sort of set up like blood drives, you can do things like sort of, a little bit on the primitive side, but basically doing kind of basic teeth cleaning and sort of expressing the importance of health.
Have you talked about like building the trust and stuff like that? I know that's something that we struggle with at our health department too. It's just trying to find like an in, and just getting them to trust us, and like our, we're always trying to get them to take vaccines. We have a very, like Dr. Louden was saying, a large Amish population. I go through and I do the 40-day reports every year, and it's just kind of
just makes me kind of sad. I go through and there's entire schools where they have 0 vaccines. So just, I know we kind of discussed this before, but it's always just interesting how you just have to like kind of ingrain yourself into kind of their society or like trying to become a part of their community. Is that?
It's basically personal relationships and just like friendships. And it works best with the same gender. So like women to women, and especially those women, outside women who are moms. And just sort of saying, it's like, this is what I experienced and this is what I know where you're coming from. And in my own experience, so like I was, actually living in an Amish community for several years before I was married, and then for a year and a half after I was married. And I noticed that it was after I got married that people started talking in different ways. They started sharing things more. Like, oh, he knows because he's married, something like that, kind of thing. And so there's that. It's the level of trust. It's also when they like if people are neighbors or something, it's like a play neighbor, you live relatively close, and then you just like invite people over, for dinner or bring something that you baked over, and then something like that, just to get to know people where it's not like part of your job, or offer to give people rides places or something like that. But then in the same way that some of these drivers can be sharing some political views that maybe not necessarily real positive, you can also share some views that may be helpful in terms of raising awareness. And a lot of times, plain people will like call people that they know and trust, and then just ask them a lot of questions. Right? I get this all the time, but I also speak Pennsylvania Dutch, and that really makes a difference because there's a real trust level there. But like this guy that called me that does the ABC Miracles manipulation stuff, which you haven't heard of before, he called me and he said, for the baby, he said, do you trust the doctor? I know the doctor extremely well. She's a skid specialist. He said, do you think we should get a second opinion? And I said, you know what? No. I said, I really think you can trust her. I said, and I would tell you if I thought you needed a second opinion. I said, it's not like I just completely blindly trust all providers. I said, I know her and I know what she's done. I also know what she's done for the plain community. I said, you don't need a second opinion. I said, she's doing the best. She and her team are doing the best that they can. I said, okay.
So there's 2 more questions online, going back to the injury prevention. What might work for this population related to injury prevention? You mentioned the dangers on farms. Anything that can be done to help prevent traumatic injuries, especially for children related to farm machinery or other dangers on the farm?
Basically doing these farm safety days and talking about things like skid steer loaders. That's been a real issue in some communities. Less among Amish because people have them, more among the older Mennonites, but sort of basic safety. And making sure that the safety tools or whatever, add-ons or whatever, in a lot of machinery are in proper working order. Sometimes certain kinds of protective shields and these kinds of things are maybe removed or not maintained or something like that, and just kind of really stressing the importance of making sure that your equipment is maintained well. And the risk of younger kids operating some of this machinery, or younger kids just like sort of wandering closer to an auger bit or something like that, the PTO shaft in the back of the tractor, backing up trailers or something, even if it's like you've got draft forces. There have been some situations where kids have gotten very severely injured because somebody is like backing up a large trailer or something, and there's like a toddler or something that's just kind of running around. Now, one thing that's been sort of, jumping in the next session, one thing that's sort of a red flag to Child Protective Service workers is say, where are the adults? And they do a home visit and say, where are the adults? It's just kids, babysitting other kids. That's generally true. That being said, a lot of plain kids are more capable of levels of responsibility than their peers in the non-plain population. I remember a 5-year-old girl changing a cloth diaper with pins of one of her younger siblings, effectively without mom right there. And it's like, and it's cloth, and I mean, I can't even do it. My struggles with disposable, but and then the pins, whatever. It was like she had, like her doll or something like that, except it was her sibling. And she like looked over her shoulder.
It's just we National Farm Safety Medicine too. And
Marshfield?
yes, and they actually have booklets too, for kids in the Amish Mennonite community, and their coloring books and activity books and stuff. And I think it's just that I saw them at Farm Tech Days this last year, but they're wonderful.
Publications like that are really good too.
Teaching the age appropriateness. I mean, I met my neighbor, their 8-year-old's running a log split. It bothers me every time we see it. And yeah, we think they're more mature, but it's still neat.
Yeah.
So trying to get that message out, that parents understand true capacity of the kid, you know.
I mean, plain people know about kids, because they have a lot of them, you know, and kids are just child rearing is just like part of the fabric of plain culture. And they don't want to see their kids suffer or die prematurely either. So, but yeah, I mean, in some cases, there's maybe a necessity to kind of raise the awareness. And certainly when there's like a tragic accident, oftentimes it has an effect that a lot of people say, oh my gosh, then we need to talk about skid steer motors or, you know, roller chains or something like that.
There was one more question online. Is there much poverty or homelessness that exists in plain communities, or is the community culture so strong that the community will care for their own if someone or a family is in need?
Yes, they will. Homelessness is non-existent. From the point of view of, like, say, the IRS, many plain people are living in poverty, right? Because their incomes are so low, and they have so many mouths to feed or whatever. But their needs, their expenses are very low. So whatever the poverty level things really are completely irrelevant for plain people, because their incomes are just so modest, but their expenses are also quite low as well. So, you know, they themselves will say, none of our people are starving, right? And if like a family is like struggling financially or something, somebody will help them out. And it could be like things like, I'm just going to go to the grocery store and buy your groceries this week, or take care of you or something. And there are some people that are just really not successful in whatever business that they do or whatever profession that they've entered, and they just need a little bit more help. And it's probably going to be coming from family members than other community members, but community is there to help people in need. And as I say, homelessness is completely non-existent, never existent.
We don't have any more online. Is there any more questions from the groups? Okay.
Thanks so much.
Thank you.